live and running and spring.
Okay. Come to order. Veronica, can you roll?
Yes, when I call your name, please let me know if you are here. I'm gonna change that view because we've got Teresa's big, there we go. That's better. Okay, so when I call your name, please let me know. Just let me know. Here, Amanda Archer. There we go. Ashley Hathaway or anyone with MCHSCoC. Okay, numbers locks is not on. So let's go to that. There we go. Brady North.
Here.
Faith Dayton.
Present.
Melissa Johnson. Present. Joanne Brewer.
Here.
Joseph Ditto.
Here.
Judy Albert. Here. Camille Leggett. Reese Martinez.
Here.
Teresa DeSimone.
I'm here.
Paul Davis.
Here.
We have a quorum. Before you move on, Paul, I would like to introduce a new representative for the City of Fort Bragg Police Department, Melissa Johnson. She's taking over the seat from Jeanette. Jeanette was the primary before us. So welcome. Glad you're here. We did an introduction on Thursday, but thought I'd make it more official, especially for you too.
Welcome, Melissa. I'm gonna open it up for public comment. This is a comment on non-agendized items. Does anybody have any public comment?
I guess my only public, well, is it public or not me? Probably. Oh, can I didn't know if somebody from the public wanted to comment. I was just gonna reintroduce that the street medicine team, our current street medicine nurse, Adrian Carfey, is moving on to a new role. So Margaret Carfey, I just wanted everyone to start being familiar because it's, I think, as we all partner together, it's great for us to know faces. So Margaret Carfey, no relation to Adrian Carfey.
Very much related.
Is our new street medicine.
Last name?
They were actually.
She's my daughter. Yeah.
Oh, okay.
We're very lucky. So Margaret brings a lot of wound care specialty experience with us specifically, which has been very valuable with our patient population. So I just look forward to having her get to know everyone better, and thank you for having her at this meeting.
Do any other public comment? Now we're gonna move on to approval of minutes. These are from the February 23rd, 2026 meetings. Take a peek at that when you're ready. If I can get a motion to approve.
I just had one change that I would request, just under announcements where it says that I was talking about Restoration House being officially closed. I just want to make that should be reflected as temporarily closed. That's all that I would request. If this is going into a public record, temporarily closed.
Is there any update?
No updates.
I move that the minutes of February 23rd be approved with the changes that Faith suggested. Second.
Thank you, Joanne.
Is there any other discussion on the minutes? If not, Veronica, can you take the vote?
Yeah.
Please.
So when I call your name, let me know if you want to vote yes, no, or abstain to approving the Brady.
Yes.
Faith,
Yes.
Melissa,
Yes.
Joanne,
Yes.
Joseph,
Yes.
Judy,
Yes.
Chris,
Yes.
Teresa,
Yes.
motion approved.
We're gonna move on to, announcements.
I'll go ahead and get started because with the one that's on the agenda. In your packet, starting on page 7 and 8, there is a flyer on an event that is called Culture is Recovery, Honoring the Wisdom of Our Elders. It's an event that is co-hosted by Nollyville Homo Nation and New Life Clinic on Thursday, March 26th from 10 to 4 on the Ukiah Valley Conference Center. There's an agenda on the back. And they're providing lunch. They request that you RSVP. And you can RSVP, and that's on the agenda front page. There's Chris Partita's telephone number and email address. It's not on the flyer, but it is on there. Priest, do you want to talk about this next one that you?
I do. I want to invite everybody to our CLOC. We got a grant for the local opioid coalition. And we're going to collaborate with everybody to see if we could get the best use out of this funding. So we're trying to get people that have organizations that want to have input on where we utilize this funding and where it needs to go. So if we can, please join. If you can't do in person, do virtual. And if you can, if you guys can't show up, please send somebody to the meeting. It'd be super important. So we can have a team of his county provide services, and we're going to collaborate with these guys next to have an event to make sure that we serve the underserved. Thank you.
So I just scanned the QR code
It's wrong.
and it opened a Zoom meeting.
Maybe that's the actual meeting.
And it says TLOC meeting registration. And then it has me join a meeting. So the QR code
Okay.
goes to the meeting link.
I see that.
Thank you for this.
Maybe that's the link for the meeting on April 3rd.
Oh, good. And then this is
There
the information.
Yeah.
Go ahead, have one as well.
We have one too. So RCS was awarded the B-CHIP Continuum Round 2 funding. So we're gonna be building a beautiful Roots Wellness and Recovery Center at B2 on the B campus. It will have outpatient mental health services, substance use disorder treatment, 24/7 sobering center, and all in the B2 space. I'm so excited. And yeah. Our partners with the county, thank you to our partners with the county, tribal health, priest, community organizations, and all the people that have helped support with this. Very excited.
That's exciting. We're all very excited about both of these announcements.
Can you just give a little bit more
Yeah.
detail? A little bit more details? Yes, I mean, in other words, like, it is in treatment.
It's gonna be, so a sobering center, or somewhere to detox. The fire department and the police department seem like they're pretty excited. They'll have a place to bring people instead of necessarily taking them to jail, just to sober up.
And how many beds would that be?
8 beds. And then, and that'll be 24/7, and then there'll be mental health treatment available in there. There'll be, there's a doctor's office in there. There's gonna be, it's gonna be big. It's gonna be on our site at the by the shelter, like right across the plate.
So how will that be different than like calling sending somebody to a crisis intervention at RCS or something. I mean, what, you know how that kind of thing, like, how do you choose? Where does it go?
We'll see.
Oh.
I don't get the sense it's linked to crisis.
Huh?
I don't get the sense that it's linked to a
It's
mental health
not.
crisis.
Yeah, it's not really linked to crisis. It's building bridges, so it's more homeless services, mental health homeless services, and then sobering center. And then there's also gonna be I know there's gonna be a safe room in there, so somebody that's just needs to chill and calm down and have a place that they can be safe to do that, they'll do that.
So we mostly, but probably working also just with clients who already go to be referred to building bridges, most likely. Providing expanded services to them.
Yes, and more.
What's your timeline? You just got the grant.
We
so-
just got the
Yeah.
announcement. We applied back in October and they
Wow.
told us we would know in April and they actually told us on Thursday. So we just found out. I don't know the time.
Yeah.
We still have to meet with the city and do all the planning, more planning stuff, and there's a lot of pieces that still need to be like.
It's just amazing how much both of what you guys are bringing to the community for so many people, and it's just awesome, so thank you guys.
We got one more, on April 1st, we'll open up our Rose Healing House. It's gonna be on Rosemary Lane up the top of Laws Avenue. It's gonna start off as post-hospitalization, but it's gonna be an SLE. Whatever it needs to be, we're gonna have an on-site staff there 24 hours a day. And have transportation, whatever needs to happen. It's just that other deliverable that is necessary to, anything we can to provide services for the members that are around here. So,
Yeah, that's awesome.
6 beds,
Are you building it or did you buy a house?
done, bought the house,
Oh,
remodeled
great.
it, yeah.
What's the address?
202 Rosemary.
That's right next door.
That's your house next door?
You go to Joe's house.
How long is
I did. I didn't see you in front of the house. I've been over there for last month.
Usually in the backyard doing the
Okay.
garden. Okay.
Do you want me to hit the YouTube and take out your address?
Yeah. Do it first.
I'm pretty sure you kind of caught on cameras already has my address. So.
Yeah.
Please, it's not quite open, but it will be.
April 1st, we're gonna
Oh,
open up. Yeah.
Nice.
Are you doing an open house?
I will be there. All you guys will be there, grand opening. Yeah,
Okay, let us know.
On April
What time?
April 1st.
What time?
I would say 4.
This isn't an April Fool's show.
No. That was good. I like that signal that. Yeah.
Reese, are you sure there's nothing else amazing you want to announce? There's so many things.
No, just hoping we get our own building one day. That'll be soon.
All right, we're gonna move on to reports presentation, starting with update local jurisdiction. The county of Mendocino first, Megan.
So the only announcement I have from Department of Social Services side is I wanted to let this board know that goal is to have a findings report from our street outreach project ready for you guys. I'm just gonna bring that to the board next month. Our street outreach project that is hosted by Department of Social Services is winding down. We're losing one staff person, but we're also faced with a growing realization after 4 years of doing this work twice a week that the majority of individuals that we're encountering have behavioral health issues, and we are almost exclusively. So we are going to spend some time transferring the information we've gathered to the appropriate behavioral health referrals, and won't be doing street outreach in the same way we have been. I'm not doing like an abrupt halt, but it's going to be trying to be transparent and also very honest and truthful about our findings. So
Could you just expand on that more? I feel like you're kind of cloaking it.
yeah, I guess I am, because I haven't really written it yet. So we have 4 years of data, including very good case notes every single time our street outreach team's out in the field. least 80% of these individuals are declining resources or declining an interest in connecting to services that might be supporting them. At least 80% have a self-reported, they state it, or we have that information from other sources because they're familiar to us, a serious behavioral health issue or a serious substance use issue or both. From the social services side, we do not have access in the same way to behavioral health resources that the behavioral health department does. I can't look up who their case managers already are. I can't make referrals to, I'm not in the AOT referral pathway, for example. We can't even make care court referrals the same way. So our ability to address these primary issues are not great. And my concern is that our team has been holding that space with the public and the political perception that we are able to make progress. And I don't think it's a good use of their time anymore. I very strongly don't think it's a good use of these skilled outreach workers' time, and neither do they. So I'm trying to do this as transparently as possible without sharing a giant database. I'm not going to do that. But when we know an individual that we've had multiple interactions with for the last 4 years are linked to another organization, we will be sharing that information with that organization when we know, which is not always the case.
I do have to say every client and every contact is reported in HMIS. So we do have a paper trail of the people served, but it's private protected information.
True. And we have case notes that are not in HMIS, but we have, years of case notes of repeated attempts to engage and in many cases repeated failures. So I feel like what I'm sharing is like a problem without a good idea for a solution. So I feel a little bit worried about that. I'm also cognizant that although street medicine technically does street outreach, it's with a medical focus and their data doesn't show up in HMIS. So when we stop doing this work, our community within the HMIS system is going to look pretty short on street outreach work. Hospitality House has a street outreach project, but really we've been carrying that ball.
I want to back up because we actually do provide a lot of behavioral health and community health worker support. That's a huge part of our team. So we're not, we have medical and psychosocial.
Yes, I think what I was explaining is why your data is not showing up in HMIS because it's from the.
But I wanted to clarify our
Yes.
program so that it's not just a medical program.
Understood, yeah.
Yeah.
So street outreach is serving many of the same clients. But that's not reflected in HMIS for a bunch of different reasons. So like when you look at the data from Mendocino County, when we stop doing this work, street outreach will not be as openly transparent. Does that make sense? In our data.
Yeah.
I'm still hopeful I'm hopeful behavioral health, I'm hopeful other people will want to engage in street outreach. I know Kevin does a lot of street outreach in the course of the work that they do. Again, it's not an HMIS project, it's not a homelessness funded project. So there is street outreach happening. It's just not happening in a formalized way through HMIS, the way our project had been happening for a number of years. And again, I just, this is probably not a thing you guys all tracked as closely as I did, but when the behavioral health department, the social service department, the public health department were under one umbrella as MCHSCoC, there was just a lot more cross collaboration and there was a lot more ability to not have to be more clear about who our clients were versus somebody else's clients. That's changed as we broke out into different departments. Social services, their primary populations are families with children, the elderly, people at risk of abuse or neglect, or people in need of Medi-Cal or CalFresh. That's who social services serves. The individuals our street outreach program is working with, most of them don't fall within those primary populations. Some of them do. And we will continue to be available to partner. Absolutely, for partner, we'll be available to case conference on any client anyone wants to. My team is always able and willing to connect anyone to Medi-Cal that needs to be connected to Medi-Cal. We have ways to do that quickly. So those kinds of social services focused services will still be available and if not amplified, because I have a strong commitment to that. But we can't lead this work anymore for all the reasons I just listed. I don't believe social services is the best leader of this work.
So it would be something that behavioral health would pick up as their own street outreach group?
I don't know. I can't speak to their capacity or interest or plans for that. Again, there's a lot of overlap in clients. Because they have to operate under extremely strict confidentiality rules. So although we do a one-way transfer information to them all the time, they're not able to engage in the sharing of information in the same way that we can. So I think that, which is why I'm doing what's called a hot handoff. I'm giving very explicit intentional information that we've had for the last 4 years to the behavioral health department. I know they won't be able to acknowledge anything back to me. But my hope is if we hand them a very clear cover letter, 4 years of case notes, a lot of background information, if they're on a pathway to conservancy or the pathway through AOT or care court, we will be supporting their work with all that notes. So that's my intention. I don't wanna pretend like it doesn't appear like I'm handing over a hot rock or passing the buck. Like I get it. It's what it is, it appears to be, but it really is from a practical standpoint that we've put a lot of thought into. So keep previewing that. I did a soft launch for a long time. The hard launch is coming. And I am gonna write a findings report that is gonna detail this. And I think it's gonna have some findings that are gonna be will not be surprising, but it still leaves us with this challenge of we don't totally know what to do with individuals who retain their own personal rights and continually refuse to engage in services. It's a really hard problem.
Because behavioral health won't have any more power if they created an outreach team to do that either, right?
Whatever tiny bit of power exists, they have a little bit more than me. It's not, it's extremely limited. Yeah. No one can make anyone do anything. That's part of the problem, right? So they have a little bit more, maybe. And again, I have seen a lot of success that the behavioral health department has had, but it's only because I know his clients and I know that, there's never an announcement of the names of the people that they have supported. It's just like they're not really there anymore causing trouble, right? So I actually have a lot of confidence in their ability to achieve things. I just know that we won't explicitly. Because I've seen it happen for a number of clients that they've been successful with. So I'm hopeful.
That's what I've been meaning to ask. How is this impacting the Heads Up project?
So the Heads Up project are referrals from law enforcement. Increasingly, they tend to be fewer and fewer that are homeless. It's just the truth. The sheriff's department sends far more Heads Up referrals than Ukiah Police Department. So they tend to be some homeless individuals, but a lot of housed individuals. They may be struggling with behavioral health issues. They may not. They all kinds of random stuff going on that people are calling the police for, but it's not actually a criminal situation. So our Heads Up project will continue. Again, there's the majority of our calls are not homeless, actually. They're housed, which is another reason I was like, there's a great need for support for individuals who are not thriving, but they are not homeless. And if we don't continue to address those prevention needs as well, they're going to end up being. So when we get a Heads Up call for somebody who, let's say the landlord was calling the police because they're really worried about this person and they're afraid they're going to have to evict them, and we're able to intervene, in this case, it's the behavioral health department, while they're still housed and keep them housed, that is a tremendous benefit, I think, especially for some of these individuals that we know have a history of homelessness. So, we want to keep them housed. So that's still a kind of early warning system. And I have staff that can respond to those calls outside of our street outreach team. So that was my update there.
City of Ukiah, Shannon, do you have anything to report?
Sorry, something wonky was happening with my mouse. I couldn't get to the screen. I apologize for not being there in person today. I think the only relevant maybe update I have is that cities and counties, in terms of housing, we operate in housing cycles of usually about 7 years. And so every 7 years or so, we are required to update our housing element. And every 7 years or so, HCD imposes a number of houses that are expected to be developed in any given jurisdiction. And that's what's referred to as the RHNA numbers. You might have heard that term before. I don't actually know why they call it RHNA. It stands for RHNA, Regional Housing Needs assessment or allocation, I think it's RHNA, but we call it RENA. And so HCD delivers that information, or they work with the local MCOG unit to disperse those units. And so we've been in this process for a couple of months now, trying to determine what the newest allocations are going to be. And the numbers are probably going to sound super amazing to you, but I'll maybe bracket that with some realities. So the city of Ukiah is going to be required to produce over 1,000 units of housing in the next 7 years, which would be amazing, right? But many of you know that the city of Ukiah is largely built out. So that task feels nearly impossible for us. We'll just have to go straight up, I guess. I don't know how we will accomplish that. Of course, we're going to do everything we can. And I should say also within those numbers, we don't have the specific breakdown yet, but it's broken down into different categories, usually income based. So it'll be, X number of units for extremely low clients, X number of units for low, moderate, above market. So it'll all be broken out, but the vast majority of the required units are going to fall in the affordable housing category at some level. The county of Mendocino is going to be required to develop over 4,000 units of housing in the unincorporated county. And that's an extremely large ask because in general, we want to see affordable housing developed near urban centers and services and public transportation and all of those things. They almost always need to be on some kind of public water and sewer system. So when you think about what that development looks like, we're just talking about around the surrounding areas of the cities in Mendocino County. So and the other caveat is that cities and counties don't actually build housing for the most part. There are things that these jurisdictions can do to facilitate the development of housing, but at the end of the day, we're not the developers. So what is our role in this RENA assignment? It's typically streamlining or facilitating the development of housing, or probably in the case of the county, that's going to look like rezoning. So what that means is that the county is going to be faced with having to rezone probably a considerable amount of agricultural land, for example, which could be contentious, to housing in order to facilitate that kind of development within the next 7 years. So that's just a 30,000 foot view of what our housing requirements will look like in the next 7 years. And increasingly, while the city of Ukiah has met our goals, we're one of the few jurisdictions in the state that has, it's getting increasingly difficult to do that. But we are seeing more and more state and federal funding sources, grants in particular, are tied to your ability to meet those goals. So that's good if you can meet your goals. It's worked well for us, the city of Ukiah, but with these extremely high numbers that will be required to meet in the next 7 years, then that's going to be increasingly difficult and could mean compromising grant opportunities and other sources of funding if the state and the feds continue to tie funding to the meeting of the RENA numbers. So that was a lot of government speak. I apologize, but this is all just kind of coming out right now, and we'll know more in the next couple of months, I think, and you'll start to hear this from the county as well. I think that's all I have.
Shannon, is HDC, is that a state requirement or federal?
HCD is Housing and Community Development, right? It's federal. A lot of the money and the requirements start with federal origination and then are trickled down to states to disperse the actual funds and stuff, mandates.
I don't know whether you know this. I'm always just incredibly curious about numbers and things like that. I mean, do they take into account like whether there's employment for those 4,000 new houses?
No. Not at all.
Oh, okay.
I've been doing some research into this in the last couple weeks since Shannon's kind of been talking about this. And I think it's actually really, really significant for us. And that this is one of the biggest avenues the COC has to try to promote as much physical housing being built as possible. HCD determines for each region how many units are needed to meet that population's need and the anticipated growth over that period of time. And I believe it's like 10 years or so. And so it's the people who are here and the people we anticipate coming here. It's a total of 6,456 units countywide. 4,386 of those are unincorporated. I could read off the other ones, but I think we might get lost in numbers. And then it goes on to allocate how those almost 6,500 units should be distributed across the jurisdiction. So how many, like for the Point Arena, it's 32 units. But for the city of Fort Bragg, it's 1173. I mean, for Ukiah, that was Ukiah, was 1173. And then it breaks it down into the income brackets from acutely low, which is 0 to 15% area median income, to above moderate, which I think is like 120% or more. And so it distributes it based on for what population, like income wise, and then where it needs to be distributed. And this might be accurate. But one of the things that I noted in the Mendocino Council of Governments report, when they were looking at how to allocate the units, so how they came up with 32 for Point Arena, et cetera, point 10, housing needs of individuals and families experiencing homelessness. It says data was not readily available, and the methodology committee did not consider this a significant factor in determining the allocation of housing units. So, and I just kind of noticed that there was a good portion, I won't say significant, but a good portion where it says data was not readily available. So I think that that's an opportunity for us to educate on like what the distribution of the homeless population is within our community. And, we have the point in time count, but we also have our service, how many people we serve and street outreach and things like that. So I think that this is a lot bigger for our COC than we realize.
Thanks, Veronica, for those additional details. You're absolutely right. And I meant to kind of bring my spiel full circle to the COC, and I didn't do that. I think the opportunity is also for the COC to advocate, lobby, support when you see housing development, because NIMBYism is a thing for sure. And so as I alluded to, if and when the county starts proposing the rezoning of agricultural land, that's going to be a difficult community conversation. And so there is an opportunity for the COC and the members of the COC to help support projects if you think it's appropriate, to advocate for that, and housing projects in general. And so I think that's where some opportunity lies. This is a conversation we're having a little bit at the strategic planning committee as well. So I think we'll start to see some of these opportunities embedded in the next version of the strategic plan, which will be helpful.
Shannon,
Thank you.
more questions or discussion on that? No, we're gonna move on to City of Fort Bragg. Melissa, anything?
I don't have any updates for the city this time.
Veronica, I only ever see this part on here. And then I forget when you send the agenda, because there's stuff that's just always on here, but You might want to change it from Jeanette.
Oh, yes, thank you. That one slipped past me today or last week. Thank you.
Right. Standing committee reports. Gonna start with strategic plan, I guess.
Well, most of us were together all day just last Thursday. So our strategic planning retreat was on Thursday. Thank you, you that were there, really contributed deeply to that process. I really appreciate it. We're all off the hook for a little while our facilitators gather all the information that they got. The community survey as well has a lot of community perception feedback in it. And so we get to sit tight for a little while they bring it together into the next iteration that they'll have a chance to respond to. For those of you that were there, I noticed in my group, we were talking a lot, but we didn't necessarily write a lot of stuff on papers. So I do think it's possible that the facilitators may be reaching out to some of you that were in those groups to just ask a little bit more about the content or what you ended up writing on papers, just because they couldn't really hear everything at the same time. But I know that we all were and contributing deeply to those questions and those themes, but we may not have written it all down. So you can all just relax and do nothing with the strategic plan while they work on the next phase of it. The community survey is still live. I think we committed to holding it open until the end of December. No, end of the month, March. So continue to share that. Or if you have somebody who's like, I have a lot of thoughts and ideas about homelessness, this is a great way for them to contribute right now.
I pulled up the QR code to the survey. If you haven't completed it already, you can pick out your phone and scan it. I am sharing this on our YouTube live stream. So folks who are watching this, you can scan that and that'll take you to our community survey. It's open through, you said the end of April, right?
End of March.
End of March. So you have until March 31st to provide your thoughts.
Again. Shelter and solutions, Veronica.
So I dropped the ball and didn't get the meeting agenda posted within the 72 hours. I was out of town for the week before and then I just did not get my stuff together. So we did not meet. I asked the team, the committee members, if they wanted to meet again later this month, if they wanted to reschedule it or wait until May. I haven't heard, the only one who responded was Jeanette, who said, yes, I can meet. Joanne, who is the facilitator, so and chair of that committee. So unless I hear a burning desire, we're gonna meet next on May 13th, here in this room at 1:15 p.m.
In this room?
Usually, yeah. Usually, right?
The last one and the other.
It depends on the availability. Sometimes it's available. This campus. How's that? This campus.
One or the other.
Specific we want to share about what we've been working on? No? Okay. Perfect.
Coordinated entry and discharge plan.
So our next meeting is April 15th, at 9 a.m. And we've been talking about working on our prioritization. But we're also ramping up to do more work on the implementation of the referral process to comply with the HUD requirements for coordinated entry. So we're looking at how the system is performing, where those gaps are. I think that a lot of folks were hoping a new prioritization would bring more equity within the system. And while it will bring more equity within the scoring process, it's more than just the score or the number and how it's with the score that they get, but it's also how clients are connected to housing and how, when a unit is available, how a tenant is selected for that. And that's really what needs to fundamentally change in order for those more significant system equity issues that we're seeing to really become addressed. So I think we're starting to really understand that as a group. And to be able to formulate a process that will actually work for our community instead of just it complies with the HUD requirements, so let's try it. But so it's been an evolving process. We are working on improving the by name list, by instead of just relying on what the case manager or the HMIS end user enters into HMIS as the response. It's also looking at how did they, yes, we'll record it here, but how did they respond to question 16 about what their current living situation is? So if they say they're, I'm unhoused, I'm homeless, but they're staying with friends or family, that's a check and balance to say, actually, this person doesn't meet that definition. And so it's those kinds of things that we're working on implementing to where we can have those quality assurance checks in place in the by name list. Anything else you would add, Joanne?
No.
Okay.
Awesome. Thanks, Veronica. Community accountability, Camille's not here.
And we're waiting for Camille to direct to.
We nothing about the membership committee either.
I do want to share that we had an update with one of our COC general member representation, Jennifer Cook, with Geo Reentry is no longer with the organization and has been replaced by Jennifer Hill. And I had a good conversation with her. She's not sure if she can make the April meeting, but she's going to do her best.
What does that leave us? HMIS and
Yeah, still me. So included in your packet, as usual, is the February 2026 data completeness report. So it helps to identify where things are missing. So you can look at that at your convenience. The next item is probably the most significant piece of discussion for today. On February 26th, we submitted the 2025 system performance measures report to HUD. This is the federal version. This is submitted every year. The reporting period is always October 1st through September 30th. That's the federal fiscal year. In your packet, this starts on page 17 of your packet following the data completeness report. So measure 1, the length of time persons remain homeless. So this looks at when they come into services and when they're exited either to housing or they disappear. We're not able to track them anymore. So it's emergency shelter without transitional housing is the first one. And then the second one is with transitional housing. So I know that there's a lot of acronyms there. Most of those don't apply to our community. We don't have any night by night emergency shelters. Safe Haven is, or SH is a model that has been discontinued by HUD. They're just still projects that exist. So this is the average length of time or bed nights that a person is experiencing homelessness. So you can look at those. The average for shelters is 120 days or nights. So that's what, 4 months? And then if you add in transitional housing, that bumps up to 150 days. And then this next one is, it's the same idea, but instead of looking at when they came in, it's looking at what their current living situation was at entry. And so it's a little bit, and so they record like when they said they began experiencing homelessness. And so that's why these numbers are a lot bigger, because this is self-report. And it's also like, where did they show up over here in this project? And then they've got a housing move-in date way down here in rapid rehousing for PSH. And so it's looking at that, not just across an enrollment, like the first, like letter A is, letter B is looking at across the system. The next page. Measure 2 returns to homelessness for people who exit to permanent housing destinations. So of the people that we have a record in HMIS, that they exited from a project type. So street outreach, emergency shelter, transitional housing, safe haven, again, we don't have any of those, and permanent housing. That's not just permanent supported, that's all permanent housing. So that includes rapid rehousing projects. And so you can see the number of people who, in a 2-year period, who exited successfully, and it was a total of 383 people. And then you can see the number of people who we have recorded in HMIS that they had a new entry into a project within 6 months, and then 6 to 12 months, and then 13 to 24 months, and then in the total in 24 months, so the total 2 months. And so that kind of gives you an indication of how people are moving and how they're coming. Yes.
Can you just clarify something for me?
Uh-huh.
The last one there as an exit was from permanent housing.
Yeah.
Is that what we're looking at? Measure 2, yeah?
Yes. And so the bottom blue line, there was 220 people who exited from permanent housing to permanent housing.
For the, right, or what?
I thought
Or,
it was people who exited homelessness into permanent housing. And then
but the exit was from permanent housing. So they exited a street outreach project to permanent housing. There were 17 people.
Oh, I see.
There were 220 people who exited a permanent housing that went to permanent housing. So that could be like a rapid rehousing program, or PSH, or EHV, or any of those permanent housing projects where they exited, but they successfully exited. So they retained housing, but just without that. So anybody who exited a rapid rehousing project that had a housing move-in date, they're counted in this. So that's a big portion of it, is our successful rapid rehousing exits. So of the people who exited rapid rehousing or other permanent housing interventions, there was 220 that went from permanent to permanent. And a total of 20 of them returned within the 2-year period.
Return to
So-
homelessness?
Can we
Yes.
double click on that? Cause I'm confused. Can you just go over how a rapid rehousing is in there?
So
Confused.
So if you're enrolled in a rapid rehousing, you leave homelessness and you enroll in rapid rehousing. I kind of hate how rapid rehousing is considered a chronic housing, but you enroll in rapid rehousing. And then you're in rapid rehousing for a little while and you move into housing. So you exited housing type with rapid rehousing into an actual house, even though you may not have physically moved, right? Maybe rapid rehousing was paying your rental assistance for a little while.
Oh,
And then you got a voucher, so your type changed, and now you have a PSH voucher. But
They
nothing
exited
changed.
the project, not necessarily the
Okay.
unit,
Yeah,
the services.
So we let somebody in, we're gonna pay you rent for 3 months,
Mm-hmm,
so we're leaving you. You're
mm-hmm,
up front,
mm-hmm,
and then we exit you from the project, you've been in your.
mm-hmm.
so for like CalWorks Housing Support, which provides rental assistance, we do a lot of rapid rehousing. So the CalWorks Housing Support pays rapid rehousing, pays rental assistance for a couple months. And maybe this person has enough income to sustain it on their own to, or we pay the security deposit for rapid housing, something else, but they're in a subsidized unit, it becomes permanent housing just on their own. So I guess the story it's telling you is if you do an intervention that is permanent housing focused from the beginning, they have a pretty good rate of staying housed.
You should have a little description.
Well, this is. I
Transition.
think problem is like this, because they use their certain HUD language, which I understand why they're doing that, and then you're like, what is the story this is telling that I'm supposed to care about?
Yeah, I would never have understood this from what you just said.
I think when what
There's an entire manual on how to interpret.
I think though, what is interesting is, so, and I don't want to stop Veronica, but I was looking at the same time, we were looking at the annual data in this like chart, which you may not believe it, but this is actually pretty clear compared to like California, whatever. This is not bad. And then Veronica in a prettier chart took these same system performance measures and charted them over time. So you can kind of see like, this is the year, this is what happened in this year according to HUD. And then she tried to make it so that you could look at trends over time, which in some ways is kind of a little bit more of the stories, with nice color coded charts. I think the takeaway that I keep resonating in my head is the federal government is making policy decisions based on this data. They seem to be drawing the conclusion. And it's going to sound funny because I just was talking about how I didn't see a ton of value in street outreach. They seem to be drawing the conclusion that street outreach has better outcomes than emergency shelter. That shows up later in some of this data. When you look at exits, like what Veronica did. Very last page. One of the ones we all like looking at is what are you doing for someone and where are they exiting? Like when you're in a shelter, are you exiting to housing? Where are you exiting? So this chart here, if you're a federal person, you're saying, well, look at that. Street outreach has better success rate than putting somebody in emergency shelter. Why are we funding emergency shelter? We should be funding street outreach. We should be funding services. I would argue that the number of people enrolled in street outreach is much smaller. So there's some wild swingings here, especially because I explained like street medicine data is not showing up here. All the work McCavin's doing is not showing up here. So I'm not sure we have very good data on the effectiveness of street outreach. But the feds are looking at these numbers. They're looking at emergency shelter that had a 25% successful, exits and saying, is that really where we want to spend our money? I don't know why they're not drawing this, if you look at this blue line way the hell up here, permanent housing obviously has a success rate. But that the relevance for us is when you look at this data, no matter how flawed we know it is, people at a higher level are making policy decisions based on it. That might not be what we actually think is a good idea, but they're using these tools to decide. They're using these tools to grade communities
But
on how well.
doesn't street outreach have to refer to an emergency shelter or someplace for them to get housing?
They're looking at street outreach directly in housing. So
Oh.
a positive destination.
And then the new model that's really being touted is completely skipping emergency shelter, transitional housing, and literally taking people from the streets into an apartment. They're doing it
So, I mean-
successfully in some of our more southern states, where they they have vouchers available, they're just not being utilized. And so they use these like project-based vouchers. I think it was in Ohio or Texas, where they literally within a 3-month period moved over 100 people from the streets into permanent housing. And there's a huge, like a high retention rate because they're doing these wraparound services and they're just really giving people opportunities to have a house. And it's really successful.
Well, if there is housing.
If there's housing.
Yeah.
Yeah, if there's not, I mean, right, that's kind of like a whole. I would say if you're in a community that's lucky enough to have a lot of vacancies. That's
Yeah,
a great way to go.
Yeah.
But when you're not.
The thing is
Yeah.
the rest of the nation is tired of hearing the lack of unit availability from California and New York and some of those more other places.
They just don't believe that's relevant. I don't know why they don't. believe
And honestly, in some states, it's not relevant. They have enough housing.
No, they
In
don't
a
believe,
lot of states, it's
but-
not real.
they don't believe that the lack of housing is actually the factor.
Yeah.
I don't know why they're drawing that conclusion, but they just, I just listened to this really disturbing federal presentation about their policies. They just don't agree with the correlation that many of us that are in housing restricted areas see. It's just, they just drawing a different conclusion. I don't know what to say about it. They look at big, huge data trends and they say when there was more housing availability, it didn't reflect on whether or not your homelessness population changed. I don't know why. I mean, I don't know what to say. I haven't lived in these other communities. I don't know what it's like to be in like a medium community where there's some housing, but not a lot. I mean, I only know here where there's just very little housing. So, but they are drawing conclusions from this data that is informing federal policy decisions.
I'm gonna keep going on my reports. Measure 3 on page 19, it is the annual count, so on a specific night. Is our change in point in time counts, change in annual counts. So this is the total served in these projects during the reporting period. So in shelter and in transitional housing, there were 615 people. 543 of them were served through emergency shelter and 89 of them through transitional housing in beds that participate in HMIS.
That was in beds. That was shelter.
Yes, shelter and transitional housing. Page 20, we have measure 4, which is employment and income growth. The data that these next few items pulled from are rarely updated from intake to exit because it's difficult in our system. You have to push a whole bunch of little buttons and it's a data area that we really need to work on. We also are really behind on annual updates for any project. So as a reminder to anyone who uses HMIS, if a person's been in there for a year or longer, you have to do an annual update, even if it's a shelter. So that we get the updates for income and employment.
I think this is really important to highlight, and I saw that in the strategic planning that it seems like it's more than one group was pointing to the need to when individuals are experiencing homelessness, want to make it living stable, like in a shelter or in transitional housing, how we need to be more aggressive about income generation for them, moving them towards employment, moving them towards SSI or whatever their pathway is to gain employment. I think that was a well-noticed area for the COC to spend more time on. And again, the federal government is paying a lot of attention to this. So they see spending all this money to keep people in shelter. They don't see any evidence that these individuals, particularly if they're able-bodied adults, so they're moving towards self-sufficiency. They're looking at this data that we rarely update for that kind of evidence. So if we're not pointing out, if we're not diligent about, okay, when this person moved into shelter, they had no income. When they move out of the shelter, oh, look, they managed to get SSI, they're getting disability now, or they're getting unemployment benefits. If we never update that, they never see that that person made some progress towards self-sufficiency. It's a hard thing to remember, as Veronica pointed out, you've got to kind of go in, you have to remember to ask the client, you don't always do that when you're exiting someone, you're just kind of like moving on and closing them out the little exit thing. You're not, and people have really wildly, they're in chaos, right? So they're not like gonna turn in their pay stub maybe, they may have just gotten a job. Like, no, not a pay stub yet, or they may have gotten a job and lost it already. So like, these are hard indicators to gather, but they are being increasingly emphasized by the federal government.
So this report is broken, this measure 4 is broken into 2 populations. There's stayers, who that represents people who on September 30th, 2025 were still active in the system. This is, you're reading the fine print and I'm just I'm learning a little bit here. It says, in addition, the projects reported within these tables are limited to COC funded projects. So this is not our system-wide performance. This is our COC funded projects performance. And we have one COC funded project, which is CDC's PSH, tenant-based rental assistance program. So of the 124 adults who were still enrolled in PSH on September 30th, 2025, 2 of them had increased earned income since their either the beginning of the year or from their intake, depending. And so that's earned income, that's employment wages. Non-employment cash income, so this could be disability benefits, TANF, things like that. Of the 124, 14 saw increases in those areas, 14, which is a little over 11%. And then total cash income, whether it's earned or non-employment cash income, 15 total people had increased income. So that means that one of those folks with the earned increase had additional income. Yes,
Can I ask a question? So you just said that these are all COC funded loans?
correct.
So what would that mean? That would be
CDC's,
for the stayers.
no, all of measure 4.
You think it's just the PSH project?
It's just the PSH program, because there was 124 people who stayed in the project. And then if you flip it over to page 21, there were 32 leavers, people who exited the program during the period. And that's about, and our PSH is 136 vouchers, give or take, depending on rents and stuff.
So what it means is like, so even though Paul's team spends time in employment and income and people that are in their emergency shelter and their transitional housing.
It doesn't get reported to Congress in this report.
Yeah, HUD doesn't care so much about them.
No.
But we might.
Are we looking at it?
We could.
We are at the California System Performance Measures level. Which I don't know.
Yeah, we don't.
It's gonna confuse things because it's
Super irritating, yeah.
Well, I'll put a pin in that for future conversation, but
yes.
I just have one more question. Just why we're grabbing a report about folks that were in the shelter, but an interim assessment had been done over in the side program. Did those changes still show up for this person? Do you know what I'm saying?
Let me clarify. So there's this person, when you say, where's the update happening? Where's the new
It's
data?
happening somewhere else. It's happening.
It will not show up. It will not come over.
Which is super irritating. So that's why.
Now, when you go to update it, it might be there. It'll be there. When you open, hey, I need to do an assessment. It'll show you, hey, George over at CDC said that this is, went up by $20. Do you want to use this? And then you have to save it and then it updates it. But it doesn't automatically crossover bleed between enrollments or projects.
I think the nuance on doing a high quality exit is really actually pretty complicated. Like making sure you get these little data things correct. That you, as you're entering it, may not fully see how that's gonna show up. Move-in dates is another one that gets things really messed up. So there's a lot of ways to go wrong on an
Well, I think
exit.
the carryover is also.
Yeah.
Confusing.
It is.
Veronica, I have a question. Can you hear me?
Yeah, hi.
So when every single year we do an annual recertification or we enter that update into the system. And when we do that, we obtain updated income information. And I mean, the majority of the people who are participating in the PSH program are receiving Social Security benefits or SSI or cash aid and things like that. And they have an increase in their income, just the COLA increase for like Social Security benefits every single year. So am I missing something? I would just think that that increased income would be a lot higher than 11%.
Well, this is based upon what CDC staff have entered into HMIS. At those annual updates, when they happen.
Okay.
So if a cash income increased from, if their social security increased by $10, if they don't enter that new amount, it doesn't know that it went up by $10. We didn't tell it.
So I'll look into that. I mean, my interpretation was that they were entering those updates because they
I
were
think they are.
waiting for
No,
them.
we went through this for a while, and you had identified those data quality errors in the annual performance report. And there was like a huge number under income and you were like, what? And that's whenever we need to do the annual updates to provide that information because says it was missed because that annual update wasn't getting done. It has since been implemented and you guys are doing it.
Yeah.
And I think it was 2022, whenever we did that. And it actually shows up in one of the charts. Let me see, I think it was the one that Megan was looking at. The very last page in your packet. Maybe not that one. Now I can't remember. Oh, it is this one. It's the increased income. When you look on page 31, we can see that in 2021, there was a jump and a total increased total income. It was at 63%. That was the year that you fixed it.
I see.
Because 63% of the people had updates that weren't recorded. And so because you caught up on that, now it's only like 10% or 12%.
Okay.
Do you think that the point that the federal government is looking at is that they got more money due to government benefits?
They're looking at.
Or are they looking at permanent housing that will then provide them with the stability to have jobs, et cetera? I'm just, I mean, it just seems silly to go ahead and say, oh, look at.
It's how is this funding being used to help people become self-sufficient?
The government, I mean, particularly certain administrations is really focused on self-sufficiency and who is able to leave getting any government assistance at all. That's always their
But
goal.
that's not what these percentages capture. If what you're saying is their social security increased.
Right, they don't
This-
like that as much as they like earnings.
Yes.
You got more government benefits, so you went up
Right.
another 6%.
So I think that's why they're forcing you to make a distinction, because
Between earned income and non.
yes, so they don't see non-earned income as necessarily a success. They like to see earned. However, I think they are willing, somebody who's really old may have non-earned income, or somebody who's disabled, or a child, they wouldn't necessarily expect to increase in earned income. So they're really trying to carve out who do they believe should be becoming more self-sufficient, and is the data showing that? And this belief that if you're providing somebody with subsidized housing, do they have less of a motivation to become self-sufficient? That's the belief that they're trying to kind of wrestle with. This is what it is, like that's the kind of permanent tension right around the purpose of welfare, quote unquote.
So I don't want to get into the weeds on the rest of 4, but a leaver means someone who exited the project during the reporting period. So page 21, there's 32 adults who left the program, and you can see the changes there. Measure 5 is it's got 2 pages to it. Measure 5 is, these are folks who show up in HMIS for the very first time during the reporting period. So they have no history in our system. We've never seen them before in HMIS. It doesn't necessarily mean they hadn't experienced homelessness before. It's just, this is the first time our system has captured them. There were, during the reporting period, the folks with entries into emergency shelter, safe haven, and transitional housing, there were 527 total people. Of those people, 193 of them had not shown up in our HMIS in the last 24 months prior. So I guess it's not ever, I guess it's just the last 24 months. And then of the persons who did not have an entry, there were 334. So 334 of our 527 were first time, which is actually kind of high.
That seems high to me. I'm kind of surprised.
Yeah. I think has a lot to do with the front door for families, because we're getting a lot more folks captured into the system than we ever have before. And they're not always populations that we would necessarily serve through traditional COC programs, because they meet like the definition 2, category 2.
Except for they say they're entering through emergency shelter or transitional housing.
Yeah.
But it still might, it might be.
That's true. Yeah. So maybe not that.
Except for some of those families may be entering transitional housing and they're not recognized beforehand. So it still could be, especially like Ford Street. I bet a lot of them show up this first time.
Yeah. And then the next one is, okay, so they split it. The first one is they don't have any history in the last 24 months. The next one is they don't have any history in HMIS, our HMIS ever. And that was people who entered a residential project, including permanent housing, was 709. It goes down to the 24 months. I don't know.
But if they're including permanent housing, they could have been entering permanent housing.
Oh, okay, that's what it is. The first one is interim housing. The second one is all housing, including permanent housing. That's the difference.
It's kind of a weird way to do it, brother.
It's so weird. Especially when I don't have
On this one, I don't know what policy thing they're doing here. I'm not sure what I can't figure out what their point is.
This report has been around for decades, so. Measure 6 has been retired. And then measure 7 is successful placements from street outreach. And and successful placement in or retention of permanent housing. So, oh, I see. So the first one is people who exited street outreach. It captured 3 people.
Yeah.
One of them went to a permanent housing destination. None went to temporary. Page 24, we've got exits from an interim or rapid rehousing program to a permanent housing destination. There were 494 in all of those project types, and 123 of them exited to a permanent housing destination, which is just under 25% successful exits to permanent housing. And then the last one is permanent housing exits to permanent housing or retention of. So those stayers who stayed in the PSH program or other projects, there were 454 total who exited rapid rehousing after moving into housing or moved into housing and remained there. And 434 of them remained housed, which is a retention rate of 95.59%. And then the rest of the packet, oh wait, there's one more. It's the system performance measures data quality. So this is like some data quality that's reported by HUD, and it's the coverage and quality. I'd have to look at the manual for more specific notes on what.
They don't like it when we record, we don't know, refused, or missing.
Right, yes.
And we did a pretty good job on not using those ones, I'd say. Like when you exit someone, they don't like it.
Yeah, they want to know.
They prefer unknown, I guess, than those.
So the rest of the packet, page 27 to 33, takes that data from this year and it adds it to the previous 5 years. So it's data from 2020 to 2025 on these same measures. This was included on Thursday's packet. We were doing a special board meeting. Any more questions?
So when we are able to, get into permanent housing, like 530 or something a year. And then the next year we have 560 more homeless people. That's the part I don't understand. I mean, where does those new 560 people come?
Well, those units that they moved into, somebody was living in them before. So that's what we end up seeing in these long-term trends is people just move around and they get displaced and then they get back in, but that as somebody else had been displaced. So until you actually introduce new units to the system, you're just moving the same people around in the same units. And that's why the conversation.
Is that really true?
I think that, we don't, we're a victim of their own sort of flawed data. I mean, when we look at the pit count over time, when we had new housing units open that year, it did go down. It did go down.
I remember.
It doesn't go down as fast as we'd like or stay as long as we like, but I don't think that dial is going to move significantly until we either have more housing units or more availability to do things like conserve people, which is also housing them in a really expensive way, right? And that not nearly all the people on the street are appropriate for conservancy, right? Even if we had that tool available to us, but it's gonna require, that's why I think Shannon's point was really well taken. It really might be that the COC, one of our more effective roles might be to continually backing up people who are building housing and saying that is the main thing that resolves homelessness. And is good for our community overall.
Mm-hmm.
You and I work with a lot of people that are unstably housed. They may not be on the street, but they went from one kind of crummy situation and they're in kind of another crummy situation. So if the main thing the COC does is advocate aggressively for housing of all types, that would not be That would be time well spent. Because otherwise, we're implying that we can solve this without housing. Which we can't. So we don't want the community to think that they can solve the problems of homelessness without us.
Well, this has been tedious today. Appreciate it.
I know. I engage and I'm like, oh my God, I have to like understand this stuff.
I just wanna say. So, a lot of us have been looking at some version of this for a lot of years. Just didn't occur to me until just now, but you know, a couple meetings ago, we asked about. How do you guys wanna see this stay and
Mhm.
what do you wanna do with it? We're in the middle of a strategic planning session here. It just occurred to me with some of these line items, and we have nutmeg here, who can help us with things, so. There are things in here that if we saw in real time, it had coordinated strategies to address. It might be helpful. I mean, I'll give you an example. So we just looked at, you know, people who were never in H minus. And correct me if I'm wrong, but when we were at strategic planning, you were on the goal that had to do with
Goal number one.
goal number one. Somebody in here was on which one was, you know, prevent
I was
people
goal
from
4. I was like,
becoming homeless the
Mhm.
first time, right? And what I didn't see on any of the goals was a strategy to use this information in more real time to figure out what our strategies should be. Not that the strategies that were there aren't also, you know, relevant, but it seems to me that if over a quarter or over a month, the providers have a system of looking at who's new this month, then it's about a deeper dive. Because for us to make the assumption that more mental health or whatever, I'm just using that one as an
Right,
example.
we're going on our
It's like,
hunches.
I don't think we actually know why we didn't know about those folks beforehand, and so that should really be part of an extended intake process, is to survey like what, you know. You're walking through the doors of the hospitality center when you just left with the sheriff kicking you out of your place. And so let's like talk a little bit.
Backtrack a little bit, like what happened?
Yeah, what happened? What services did you know about and didn't you know about? Is it some marketing thing? What could have been done? Does every provider, when they get that person in the door who's 2 or 3 months out from this thing, do we have like a coordinated, not that there's a lot for these folks necessarily, but is there a coordinated, you know, can I put you in touch with this, that, or the next thing? I mean, but all that information is kind of right in here. There's other points there too. I mean, I would just rather be able to say, quarterly, a list of names, like who should we be asking specific questions? Who should just have an interim right now after 3 months of being anywhere in our system to go, did this income get recorded? You know, that kind
I
of
think-
thing. And so I feel like
I think what would be helpful, and I don't know if it's gonna happen through the strategic planning process or here at the COC, and so Veronica has to pull out all these reports constantly, like, cause some agency, the federal government or state government is making you look at a bunch of data that they have decided is their priority. But if the COC could go get down to like 3 things that we really care about, we wanna look deeply at who's homeless for the first time. We wanna look deeply at exits from this specific kind of project or something, then we can really spend more time on them. But it's like filtering out, what is this noise? Maybe it's noise somebody else cares about, but what do we care about? In an orderly way that we think that we can contribute better quality data to or learn something from.
Yeah.
I'm always, I mean, in our own project in Front Door for Families, we've been doing this long enough that there's a subset of people who have a sustainability plan. They have a plan for how they're going to sustain rent, and it's just not working. Like they keep coming back, right? And we're going to spend more time trying to figure out what are the characteristics of this family, who's not pulling it off, and why. But it's taking this deeper look, and I think the idea of looking at who just showed up homeless for the first time, why is that happening? And maybe there is a quick intervention, right? What we were talking about in our prevention group was landlords often know. Like if we could get an alert from the landlord, which then we found out was illegal. They were like, here's a hotline. The landlord can tell us they just submitted a 30-day notice. Wouldn't that be great? And then we could go do it. And Erica was like, I don't think they're allowed to do that. So, but the concept of who is the early warning system of somebody who's about to become homeless, and how can we get that information? Because maybe there is a prevention that could happen then before they end up in shelter. Especially if it's something that's got a small amount of money. That's the part that drives me
Yeah,
crazy.
it's just a small amount of money that could save.
It is worth trying to save that and that housing situation. So they don't do what Veronica was pointing, it's just kind of turning in and out, and we don't really get stability, which is what people need. So I think if the COC can identify the indicators they really want to drill down on, we can figure out a way to do that. Rather than have this level of presentation, which is really important, we could spend more time on one of them with real, localized data to really look at it more carefully. Gosh.
And one more thing under the HMIS committee, and that's on the top of the agenda. So maybe
Yeah, so it's something totally different. It's not data. So if the COC board remembers, we've had this kind of long ongoing conversation for about a year on homeless related providers who've been interested in access to HMIS. We had two categories of them. At one point we had providers that were like community support providers. We couldn't quite tell who they were, and they were like, hey, we'd like to have access to your HMIS. And we're like, why? I'm not totally understanding that part. That's sort of sitting there. But we had a much more direct request from the Fort Bragg Police Department, which is funded to do an emergency shelter for access to HMIS. And we got caught in this, like, is it legal? Is it not legal? Do we even know if it's legal? How do we figure out the answer to this question? You guys gave me direction to get county council review on that. It got stalled because our county council ended up being appointed to be a judge, and it just kind of was stalled for a little while. Back on track. We do have a county council person, her name is Lori Sicard, who's prepared to give us a legal opinion on whether or not we can welcome a police department and under what conditions, if any, to engage in HMIS. Veronica and I had a good meeting with the new chief of police and Sarah McCormick, who some of you might remember from City of Fort Bragg, to kind of bring them up to speed on where that pending request was. What we're waiting for right now is Fort Bragg Police Department to send us a very specific request of what kind of HMIS access they're looking for. And then our county council will be prepared to provide a legal opinion, which she will provide as both a written report, and she can come to a meeting to answer questions. And then we'll finally can kind of put this question to bed. So Melissa, this is mostly about your project, but so I would like to end the conversation one way or the other and not leave it in limbo this whole time. So look forward to that. That's it on that. I don't think this meeting actually be taken.
So
ad hoc committee.
we're-
Each two.
there's an item in here about policies, procedures, and manual revisions.
That's what Megan just did.
We just talked about.
Yeah, it's because once we have that legal opinion, we can update the policies.
Got it.
Yep.
So now we're on ad hoc committees,
The sheltered pit count is in process. HUD hasn't opened the website so we don't know what data errors we have and things like that. So until HUD opens it up, we're kind of in a holding pattern, working on getting a template for our non-HMIS participating shelters and transitional housing to report their clients. So more on that soonish. gonna bump to the next one.
Yep.
On the ad hoc funding committee for RFP 4-26. I'm gonna be convening the review team to review the 7 responses that we received. We're waiting to hear back from behavioral health if they're gonna participate, and then once we get confirmation of that one way or the other, then I can schedule a meeting, the first one.
Questions about any of that, comments? On the projects. The Mason County Reentry Collaborative, wants to be a report on that?
Yes, we met on Wednesday, March 4th. There wasn't a presenter or a presentation brought to that meeting. But some announcements they made. They're going to have a reentry resource fair sometime during the week of May 13th. If you would like to table at that event and provide resources, then you could get in touch with Buffy Barassa. And they do want anyone tabling to bring something for a raffle. And then the next meeting for this collaborative is on April 8th at 11.
Behavioral Health Advisory Board.
Neither of our folks that give that report are here. Did anybody attend the last meeting?
I can give it sometimes, but I just can't make it over there every month, and I didn't. I'm not. This month either. Okay. Our protocols and governance, non-funding. Veronica, can you tell us about that?
Yeah, our HAP round 6 application was accepted by HCD, Housing and Community Development, state of California. Pending the approval of the MOU that this board approved at its last meeting and at its February meeting, and will be presented to the Board of Supervisors for the last final approval on April 7th. I was hoping to get it a little earlier than that, but we were missing a signature and missed the deadline. So it'll be finalized April 7th. I received the new authorized signatory form, which the state requires every time we have a new round of funding to say who's allowed to sign these grant agreements. And so that'll be included when it goes to the board on April 7th. Once we submit that, then we'll probably get the stamp. So moving forward, well.
I have a question. Is this the one where, like, in terms of the question, I got bounced back on the encampment or lack of encampment ordinance, and so
Correct.
the deal is that included in there is language now that by September, the county is gonna have something in place regarding encampments.
So Megan is taking the lead on that one and she stepped out. But we had a discussion with the state staff about what is actually what's being requested for the encampment resolution. And we asked, we have this protocol that the county has with the city of Ukiah. Would something similar with that, instead of an ordinance, would a protocol be acceptable? And they said yes. And so it's not going to be an ordinance as far as the grant application is concerned. It's going to be a protocol. Megan, can you take over on the HAP 6 update on the encampment resolution? I know that it's going to be not an ordinance for our purposes.
So I've sent a draft encampment coordination protocol to the sheriff for his review, because most of it has to do with law enforcement agreeing to a process. I have not heard back. I don't think it's a super high priority of the sheriff's office to kind of figure this part out. But as Veronica pointed out, we have a deadline of September 30th to deliver them a policy language that's acceptable to the state. So.
And it's the same thing
We're
for
gonna
the
have to do this at some
COC,
point. Yeah.
but it's gonna be a protocol for our contractors to use.
So I don't know what, I mean, it's sort of a little bit out of our hands. We've said this is the framework that the state is requiring us to do. Here's an example that we think is mostly going to meet the expectations of the state. There's some things that I think are a little bit unclear. And it's up to our local law enforcement jurisdiction in the county to really engage with it.
And what's the difference between a protocol and ordinance? Ordinance has to happen and
The
a
ordinance,
protocol is kind of
yeah,
guidelines.
I think part of it is the authority level.
yeah.
An ordinance has to be approved by the Board of Supervisors. And it's like a law.
Right, that's right.
The protocol is like more of a indicator of how we are going to work together. When a law enforcement agency makes a decision to address an encampment. Again, I'm not sure. This has been a new and strange position for the COC to be required to develop policy language that substantially involves jurisdiction and substantially involves factors outside of the COC's control. So, see what happens.
Did that address everything?
I deliberately left out trash out of the protocol, which is unfortunate because I know that's an issue that a lot of people, including me, find that's like this super unresolved issue. So responsibility for who does trash mitigation is not addressed in the protocol. I think that's unfortunate, but again, we don't have trash mitigation resources or ability to do that.
And it's not a requirement.
No, the
State
state did not.
to address that, right? It's how are you helping the people? How are you noticing them? How are you making sure that you're doing trauma-informed care and that you're offering
There's some
opportunities for
efforts
them
to-
to
yeah,
go
and-
somewhere else?
And there's a lot of some stronger language about storage of personal items.
Uh-huh.
There's the requirements to be attentive to those things. I think the reason I brought the trash is the city of Ukiah's encampment coordination protocol that we have right now. The city does very, I think, generously, take responsibility for the trash cleanup. So that's been really lovely that the city of Ukiah just assumes that responsibility. The county side has been less able or interested in assuming that responsibility. That's why some of the encampment sites like Herman Creek and Talmadge, which are pretty hard to clean up, to be honest, but they continue to be a sore point of contention and confusion.
And that's it on that.
Any update on the HUD?
I wanted to share that Congress, when it did its continuing resolution to fund the government through September 30th, 2026, because they had done a stopgap that ended like the end of March or something. Whenever they did the language for the THUD, the Transportation Department, and the US Department of Housing and Urban Development, they're combined into the same committee. They included language in there that limited HUDs or provided more direction to HUD on what it can do with the next 2025 COC NOFO. It included that they cannot cut permanent housing. They can't reduce it more than 40%. So they have to refund it at least 60%. And there was some other language in there, but that was the biggest thing. was what we were asking Congress to do, even though it wasn't 85 or 95%, 60 is still a win. Because that means that's a project that we can maintain staff, we can maintain clients. We can, maybe we'll match some funds with some local dollars or something to be able to keep people in housing. I know that the state of California has a bill that it's considering to provide funding, continuing funding for any COC permanent housing projects that got cut. I know that Priest has been a big advocate with that, talking with the governor and other legislators to say, hey, this is the safety net, and if you cut it, people who we're supporting, they're gonna need help again. And so we've got some avenues, and that's all to say that we just don't know until it actually happens. But we've got some protections in place that we didn't have before, but it's only for fiscal year 2025. I don't have any other updates unless people have questions about EHD or EHB. Right, I think
I'll be right here in this room on,
this.
Oh, I forgot, it's April. Our next meeting will be April 20th. Great.
everybody.
Yeah.